30-year male. He had an injury from height, and he was landing, and he landed incorrectly to have this injury. Now, badly shattered ankle on both sides, and these are his injuries. See this on right side, this is bad. There is no tibial platform remaining here. Left side talus has sunk down, and this some of the X's are missing. So the right side ankle is totally smashed. Here there is no talus to recreate. Here there is talus, but it has gone down in the midfoot. Unfortunately, some of the midfoot X-rays I did not post here. See this, on one side there was significant comminution of talus because he had fall from significant height, and on other side midfoot was gone. So our plan, definitely it was beyond reconstruction, but I just wanted to show through this case how initially it was planned with the fixator. Once the soft tissues were all right, what we did, cleverly managed. Of course, fusion needed to be done, but on one side we did hindfoot fusion, so that we kept the midfoot intact. I just want to show you the function that even after such a ghastly injury, see this now on one side, because there was no talus here and even tibial platform was not there, hindfoot fusion was done, but even intact talonavicular joint gives you almost 10 to 15 degree of dorsiflexion. And on another side, yes, see this, talus had dislocated through midfoot, and that's why it had dislocated through ankle as well. So talus had gone down through midfoot, and midfoot was bad here. So what we did, see this midfoot was beyond reconstruction. So this is called as reconstructive fusion. I mean, we did fusion of midfoot to reconstruct the ankle. See this, allograft was used. Midfoot, good alignment we got, even the subtalar we fused, but got the ankle right. See, so on one side he has a good ankle, and other side ankle is fused, but the talonavicular joint is good. See this. So ultimately the outcome is so rewarding because you have done, you know what is the functional need of the patient. You just see how it went on to heal. This is immediately when he started walking, and he's a naval officer.
Sampat, one question.
Yes.
Side where you had a very badly comminuted talus.
Yes.
Did you use any iliac crest or?
Yes, there.
Or the allograft itself?
No, here I used medial malleolus or tibial platform itself. Here this bone chunk we used it for the talus, and but on another side, that is on the midfoot side, we had to use the
allograft. Okay.